If you think therapy is just about paying someone to listen to you vent, listen to this. I'm Elise, therapist for a million years, coach for therapists who need to earn more money. I was in a session today and I was acutely aware of how many things I was doing simultaneously. It's not always that evident, but I'm listening to the words. I'm also paying attention to the body language, to the expressions on the face, to the subtext, to what's not being said, to how what's being talked about ties into what I know already about the person, how their past informs the present, right? Decisions they're currently making that maybe aren't working for them. I'm like scanning, like so much at the same time. And that's what therapists do. And it's almost like a behind the scenes kind of work because it isn't evident. You're sitting with someone, they're sitting in a chair listening to you, but you may be unaware of just how much they are doing all at the same time, unbeknownst to you. It's so much more than just listening. Yeah, listening is important, obviously, but it's being able to tie things together and to pay attention to the subtleties that may be happening in the room that a layperson may not even pick up on. So, there's a reason therapists go to school for a long time, have to accumulate a lot of supervised hours. I was talking to someone today about if we counted up how many hours we have done in our respective profession, what would that be? She's an exercise person and I think she said something. I don't remember her number. It was crazy high. I was like, oh my gosh, if I had to count up how many therapy sessions I've done or how many hours of therapy I've done in 20 years, someone do the math. It's a shit ton. Is that a number? A shit ton. So anyway, that's your little education moment about what it is to be a therapist and why it is a profession that needs to be valued, respected, and adequately compensated.